Thank you everyone for coming. This is always a fun conference. We get lots of good discussion. I'm going to talk about ACL rehab today. And a very important part of ACL injuries is returning to sport and when we allow our patients to return to sport. It's possibly the most important conversation that we have with our patients at the time of injury and throughout their recovery. So just since it's the first talk of the day, I thought I would start with one anatomy slide. In the middle of the knee is the ACL. It's a ligament that helps control the stability of the knee. And it is an injury that we see commonly in our athletes. The mechanism of action that we see, and I'm describing this because it's important on the backside for the recovery, because we want to get patients to a point where they're not going to re-injure that ACL. So most commonly we see it as a non-contact injury. The foot is planted, it can be flexed with a pivot. You can also have a hyperextension injury. As we're going through the recovery process, we want to make sure that our athletes are physically prepared so that they're not going to re-injure this, so that their muscles are strong and balanced. I'm going to just show you one video to see the mechanism of how an ACL can tear. So you can see number 7 plants our foot, flexes, and goes down. And that's a very common picture that we see on the sideline of an athlete who ruptures their ACL. The next stages for us as a physician, as we see them in the office, we have the conversation of what are those next steps, and we reconstruct the ACL if they have a full tear. What that means is we take a tendon from their knee, generally, and make a new ACL. And in order to get them back into sports, we have to look at 3 components of getting that ACL to heal. One is the biological healing, the second is their physical readiness, and the third is really their psychological readiness of returning to sport. And even at that first conversation, when we're talking about 9 to 12 months down the road, we need to address all of those issues with the patient at that time. So to touch upon the healing of the graft, that's kind of the first conversation or part of it. And we may not go into all of these details, but this is going to be the basic guideline of when we're going to allow a patient to go back to certain physical therapy components. So the first is that early healing. So we're going to take a tendon and we're actually trying to make it into a ligament. So we're going to replace it, we're going to hold it in place with buttons, with screws, but what we're really doing is trying to ask the patient's body to heal that tendon in place. So initially we actually see a decrease in cellularity. So we're going to see that that tendon gets weaker before it gets stronger. During phases, the second phase, which is proliferation, which is kind of weeks 4 until 12, we're going to see actually the decrease in mechanical properties. So again, it's going to continue to get weaker before we see it get stronger. The final phase, which is maturation or ligamentization, again, we're trying to get this tendon to turn into a ligament, that can take up to 6 months, and there are actually good studies that show it can be up to 3 years where we see full maturation of that. And that's important because we don't want our patients to go back too early before that ligament is strong enough. So the second part of our conversation of returning to sport is going to be a patient's physical readiness. And that is a big part, and then we have a lot of physical therapists in the room. They are going to get our patients back safely, and they're going to work on first range of motion and then start to work on strength and then agility and sport-specific exercises. So the first couple of phases of physical therapy are working on range of motion. The first thing we're going to focus on is extension. That's getting that knee fully straight. That's going to be in the first couple of weeks. Second phase, we're going to start to focus more on flexion. We're going to also work on strengthening. And so we're going to start early with quad strengthening, isometrics, and progress from there. 6 to 12 weeks, which is kind of phase 3 and 4, we will focus on maintaining that motion, but we're going to start to have the athlete doing a little bit more. They're going to be progressing with walking, they're going to be progressing with quad and hamstring strengthening as well as glute strengthening. And we're looking at that at the end of that period that they'll have about 80% compared to the contralateral side. The next 2 phases, which are really progressing with running and progressing again with that quad and hamstring strengthening, by 3 to 5 months, we want them to be at approximately 90% of the other side. And then that final phase is 6 months and beyond. And that is when we're going to focus on agility exercises, further quad strengthening and hamstring strengthening so that they get to 95% of the other side. And then a lot of very specific agility testing will be done during physical therapy to get our athletes back and to let us know if they're really ready for sport-specific activities. So as we look through that progression, the patients are going to go through things like walking, landing, running, specific jumps. And then finally, sport-specific exercises, and then returning to full sport. So as we go through this process, we don't want to throw all of this on our patients on day one, but we're going to take them through this progression. And every time they come back into the office to see us every 6 to 8 weeks, we're going to have the conversation of where are you in this, and are we progressing? Do we need to focus on any specific area? So to show a few pictures of those physical therapy exercises, they're going to learn to walk again. That's, a challenge in the beginning, and we need to focus on that step alone. They're going to start to look at bilateral squatting, so they're going to squat on both sides, both legs. Then they're going to start to do single leg activities, squatting, landing bilaterally. Again, we're going to start with both legs first so that the patient can really work on balance, and then progress to using one leg. They're going to start to work on running, really focusing on techniques and their form in that. Then they're going to start to drop with both legs, jumping, single leg deceleration, and then very specific cutting exercises. The final stage is they're going to get back to sport-specific agility, sport-specific exercises, and we're going to look at what sport that athlete is doing, and then the final phase is return to full sport. So there are a lot of different specific activities that we're going to monitor the patients. And here is an example of one of those exercises. And we're going to look very specifically, not just that they can do it, but we're looking at their hip balance. We're making sure that their knee doesn't drop in. And our physical therapist will spend a lot of time on this with the patients in the office. The final component of whether or not we consider our patient ready to go back is their psychological readiness. And I'm going to show on this a lot of questions. And I'm doing that because we showed a lot of exercises that our patients will go through. They're going to walk, they're going to run, they're going to do hop tests. We're also going to go through a very extensive set of questions with them, psychological questions, readiness questions, how confident they are. And we're going to go through all of these with them. And it's not just one time. We're going to ask these questions throughout their recovery. And we're going to have that communication from day one so that when they're ready to go back, often at 9 months or beyond, that we've already had these questions and we prepared them for that. So we're going to ask questions like, are you confident that you can perform at your previous level? Are you confident your knee will not give away? Are you confident that your knee is going to hold up under pressure? Are you fearful? And those are questions that we want to ask again along that progression of recovery so that they're prepared when they go back and they are confident on the field. Studies have showed that when you look at this is a specific test and it gets scored, that at 6 months, if a patient has a greater than 60% score, then they are highly likely to return to sport by 12 months. If they have less than 39% at 6 months, they're very unlikely at 12 months to return to sport. So this is something, again, we want to have that conversation along the way so that they are ready. So putting this all together, at ONS, we have a specific test that we use for our patients. Our physical therapists will use it. All the physical therapists in the community will use this to help decide if our patients are ready to go back. And again, we combine those things. We wait at least 6 months generally to do this, and that's based on that biological healing. So again, we're incorporating all three of those components in it. Then we're going to look at their physical readiness. We're going to take them through a set of testing, looking at their hamstring and quad strengthening, looking at some of those jump tests. We'll then look at their psychological readiness, and we'll give them a score on the ACL Return to Sport questionnaire, which again looks at those psychological components. We're going to see how confident they are, how fearful they are, and we're looking for them to have a passing grade of 85% or more. And we're going to look at that. If they are far from it, we'll find deficits where they may be physically ready, but their psychological score is far off, and so we need to approach those and have conversations with them of where they may have a gap. This picture kind of highlights what we're looking for in an athlete. If we took the lines away, it would be very subtle to see the difference. But what we notice on the athlete, when the before picture on the left, is that her hip drops and her knee collapses in. That's the same position that's going to get you into trouble of tearing your ACL initially, and we don't want to have an athlete go back on the field if they're at that point and they don't have good balance. So we're looking more at the patient on the right, where she has a neutral pelvis and a proper alignment of that knee. That patient is ready to go back to a sport-specific activity with a decreased risk of re-tearing that ACL. And that's really what we want to avoid, and we want to have our patients go back healthy and avoid every injury. I think this is possibly the most important slide of my talk today. And that looks at what is the risk of re-rupturing your ACL. We do not want our patients to re-rupture. This is a long recovery. They're pulled out of a sport for a long period of time. Many of our patients are adolescent athletes. This is a really big part of their identity, so we do not want to have them go back too early and have a re-injury, which is really emotionally challenging for our athletes and physically as well. So there's a study out of Delaware and also ACL cohort study, and it basically noted that there's a 51% reduction in re-injury rate for each month that you delay return going back to sports up to 9 months. That's significant. That's a really significant, that is just time it takes to get back. The second is that there's a 7 times increased risk of a new ACL injury for athletes returning to sport before 9 months. So patients come in and they say, can I go back at 4? I feel ready. I'm running. I'm doing my agility exercises. Can I go back at 6 months? Why can't I go back at that time? This slide to me is all the information I need to tell my athlete, you're 16, I want to get you back, but we need this additional time to allow that graft to heal, to allow you to be physically and psychologically ready. So to sum up everything that I've talked about this morning, the return to sport after an ACL is the decision of when an athlete is ready to do that is one of the most important parts of the entire process of my job of fixing it in the operating room, of our physical therapist, working with the patient for 9 months and beyond. That decision of when to return is one of the most important things that we can all have conversations with our patients. Return to sport, again, really relies on the biological healing of that graft, the physical readiness of the athlete, and the psychological readiness of the athlete. And return to sports prior to 9 months has a much higher risk of re-injury. And that's it. These are just references to that.